Wonderful. Well, here it is, just a few minutes past the hour, and we would love to go ahead and get started. And thank you all so much for joining us. I'm Dr. Gigi Shamus, of course, and you are at the interview with a successful acupuncturist. We actually have several different acupuncturists. I'm an acupuncturist. Professor Frank He is an acupuncturist, and Professor Marc Velez is with us as well. And I wanted to tell you a little bit about each of them. And of course, this is brought to you by Five Branches University. Our main website is fivebranches.edu, and we'll be answering your questions about all the different changes that we've all gone through in the last year and a half and what a career in acupuncture can do for a person. So we have all experienced it in different ways. Myself, working for the university, and Dr. Frank He is here, and he works for the university as our professor even to this day. And both Marc Velez and I had him as our professor when we were students at Five Branches. And so let me tell you a little bit about the different aspects we'll discuss. So we wanted to get you started by letting you know that Frank He is a QME, so a qualified medical examiner, as well as a graduate of our DAOM program. That's the Doctor of Acupuncture and Oriental Medicine. And you all asked some questions about the QME, and Marc Velez is also a QME, a qualified medical examiner for the state of California. So we're going to talk a little bit more in depth about that. And we wanted to let you know as well that I'm very excited actually to hear from Marc Velez. He and I went to school at the same time, and he works now at the Sutter Health Institute for Health and Healing. So that's their integrative medical center. So we're all going to have a lot of fun asking him about what he's been doing. So very briefly, if you could start us off, Dr. Frank He, and tell us a little bit about what brought you to acupuncture after you grew up and you became interested in acupuncture, and also specifically what brought you to Five Branches.
Thank you for the opportunity. Hello, everyone. My name is Frank. I grew up in China in a small village. Modern medicine was not quite available. So we had maybe one or two, we call barefoot doctor for the whole village. So basically, when anyone in the village was sick, and will just knock the door. Doesn't matter any time of the day or night, and then you can just knock the doctor's door and then come in. There may be some painkiller, but most time they will use acupuncture or give some Chinese herbs, and that's how I grew up. I have skin infection. I have tonsillitis. All I received was just needles. I was so scared because that was a long and thick needles went through my, my neck or my throat. I feel like, I can feel the needle tip in my mouth. But I was so amazed, and every time it always worked. So I was thankful my father brought me, when I was sick, brought me to the doctor all the time. So, and then after high school, after high school in China, you can go to college or medical school straightforward. So I told my parents I want to be a doctor, and then they asked me, what kind of doctor, Chinese medicine or Western medicine? I said, Western medicine sounds very good, it looks good, but I think it just doesn't seem very practical to me. I remember those doctors who treated me, they only carry a small bag of needles and then maybe a couple cotton balls. They don't even use alcohol. So I thought maybe a Chinese medicine doctor just sounds very practical, nothing more to carry around, just treat people with hands or some needles. So I told my parents, that's what I want to do. And then, so here, I went to the University, Liaoning University of Chinese Medicine. And after master degree, 8-year study in sports medicine and neurology, and I got a chance to come to America. And then I got in touch with Five Branches through Dr. Miriam Lee. She recommended me to Five Branches back then in Santa Cruz. So I was happy and honored to know Dr. Joanna Zhao and also Mr. Ron Zeidman. So those two very important person, in my life. They landed me a job at the 5 branches, and then that's how I started the 5 branches, America, my dream. Yeah. So I'm happy, I'm thankful. I never taught at any university, but only, 5 branches. So, and then I want to say thank you to all the faculty members and also the students, especially in the early stage. They gave me the opportunity, and then they were so forgiving, when I was teaching. Back then I was just a newbie, green hand. So after so many years, I really appreciate. And now we're on the same level, with Dr. Marc, and then also, the the moderator. How to say your name, Dr. Shaman?
I actually, Gigi Shamus, or Dr. Gigi, is perfect.
Okay, Gigi,
and I often joke that I wish I had gotten my doctorate from 5 branches. I didn't, and it was a mistake. And I wish I had. I got my master's from 5 branches. And so I'm glad that you all are getting your doctorate from 5 branches, because just like you said, that's the only place to get it. And I have seen the light. Sometimes you think there's many options. Actually, this is really one of the very, very best, one of the top options. And that's what we're here to talk about, is really how we bring that medicine into fruition.
Yeah. So anyway, I just, had so much faith and also love with 5 branches. And I was glad to be the teacher as well as the student for the first doctoral program, class. And Alex has been, doing a lot of work with me, and whenever the school has some event, and I will be always available. So today I'm really happy and honored here, and be on the panel with my favorite student, Marc. So now he's a QME. We have so much to learn to exchange. Yeah, thank you.
That's so wonderful. Thank you, Professor. And that leads me right into speaking with Marc. Same question: what brought you to Chinese medicine, and what specifically brought you to 5 branches?
That's Dr. He's story is so moving. I'm really touched by what an amazing life you've had, and how far you've taken it. It's just really beautiful to see that. Mine is probably a little bit less exciting. I grew up in the Bay Area. My parents both suffered from autoimmune disease, and I saw that despite their frequent visits to specialists, in rheumatology and immunology and whatnot, their health did not improve. And they were taking a lot of medications that actually made their health worse. And at some point, my mom decided that she was just going to get rid of everything and change the diet and engage lifestyle changes and things. And everybody started to get a lot better at that point. And so this was very inspiring to me. And that's when I first started to explore the herbs. I was in high school, early high school. And around that time, I was dating a young woman whose mother was an herbalist from Hong Kong. And this one day I was catching a cold, and she said, "Oh, take some of these little pills." And she poured 8 little green M&M shaped pills into my hand. And I took them, and I got this strange catnip aroma that came up through my lungs. And then I didn't get sick. And I thought, wow, that was interesting. And so anyways, this was the Yin Chow formula. And that was sort of my first exposure to the Chinese herbs. And she also had this pantry full of mystery. I mean, there was all kinds of roots and flowers and things in jars. And I was just fascinated by it. So in any case, my junior year in high school, career counseling day, my career counselor asked me, "Marc, what do you want to do with your life?" And so I said, "I think I want to be an herbalist and an acupuncturist." And he says, "Kid, that's just, it's just not legitimate. What else are you interested in?" And so I wound up going to university for psychology, probably spent 7 years studying different aspects. Spent a lot of time studying neuroscience, actually. Any case, one thing led to another. I found myself working at a print shop in Sonoma County, and I was enjoying my work very much, but I realized that I needed something more fulfilling than working on the computer all day. and smelling ink fumes. And so I threw caution to the wind. I put in my notice at my job. I broke up with my girlfriend and gave notice to my landlord. And on a wing and a prayer, I applied to 5 branches. And Eleanor was gracious enough to accept my application. It was long after the cutoff date. Have my letters of recommendation, and I was just praying, and lo and behold, everything seemed to fall in place very nicely. It was very strange. It was as if the universe had started to roll out the red carpet for me. I met somebody who was about to graduate from 5 branches, had a good conversation with him, like up in Northern California, a total random meeting. A lady overheard our conversation. She lived in Scotts Valley and said, "Hey, I got a room for you if you want to come down and stay in Scotts Valley till you get on your feet." Everything was just unfolding beautifully. And so there I was in Santa Cruz. And it was really one of the most transformative experiences of my life. And it was a little scary, just kind of jumping off the cliff from having, everything in place. I was paying the rent. I had a good career. Everything was stable. And then all of a sudden, boom, free fall. And it was really great. I made it through school. I'm grateful to Dr. He for his classes. Your sports medicine courses have taken me very, very far in my career, and your encouragement to become a QME, a qualified medical evaluator. Shortly after graduation, I went and I got certified, and all of those things laid a very good foundation for my future career in acupuncture. And so I'm humbled to carry this tremendous medicine and to continue that lineage. And so I'm starting the doctoral program in the fall. So pretty excited for that.
That's right. That's so exciting. So you're going to be starting with this next cohort, and that's going to be starting in just about a month or so, I heard. That is so excellent. And we want to hear a little bit more about, what led both of you to the careers that you have undertaken. And I was thinking about this seminar earlier today, and I was thinking about how each of us has made our own path. And I love that we're all acupuncturists, but we did it in different ways. It's kind of very cool to me. We have somebody who became a professor and someone who, became I would say an integrative hospital, acupuncturist. So you work in a setting that's not exactly in the hospital, but it's kind of an offshoot of that hospital setting. And then for myself, I was in private practice for many years and now work for the university that I know and love. So we're all kind of in this mix. And I wanted to ask Frank, if I could, tell us about what it's like being now a professor at 5 branches, and also you have your clinic. And we can see your scrubs and everything that you've got on. And tell us a little bit about what that's like having those 2 jobs.
Oh, thank you. I think being a professor, especially in medical practice, acupuncture is a healing art, it's medicine, basically. So I think experience very important. So you have to draw the cases from your practice on a daily basis and bring all the information you share at the school class, and then that will turn into the first-hand experience for your students. Sorry about that. So in order to be a good professor, a good teacher, you have to be a good clinician. So the more patients you see, the more experience you can collect from your practice and you can bring to the classroom. That's one thing. And also on the other hand, we are medical professional, and then we are choosing acupuncture as a profession, as a career. Probably for some people is going to be second or third career. So as a teacher, you also have to be a role model to be successful in practice. And then so your students will see you as a role model and then see, oh, in the future, I will be someone like, Mark or Frank or, David. So I think that this is going to be an inspiration for the new generations. So I think that's how I take my responsibility, a good clinician, and a good professor in the classroom.
Very good. And Marc, I wanted to ask you something that you touched on earlier, if I could, and this has to do with some of the specializations that Five Branches offers. Of course, we went at the time that we got our master's from Five Branches. Now you're going back and getting your doctorate. Today, you can jump right in and get your doctorate right away. And so tell me a little bit about what it's been like for you having specialized in things like athletics, sports injury, and orthopedics.
Well, that's been particularly helpful. As acupuncture, as it's practiced in Western medicine context, tends to only be reimbursable for pain syndromes of any sort. You get all the musculoskeletal pain stuff. So knowing how to treat it is especially useful. I do see the gamut of everything, and all through my practice I've treated everything. And so I started off sort of with a little bit more biomedical approach to my practice, very much sports medicine focused. As a martial artist also, that was of great interest to me, treating injuries and whatnot. As I started to deepen my practice, though, I realized that there's a very large psycho-emotional component to the healing process. And so started to expand my studies in that direction. While I was at Five Branches, I had the opportunity to attend five elements focus courses, although that was not my specialty. In retrospect, I kind of wish that I had taken more of those classes, but no regrets, because everybody starts off in a certain way, and then as you actually start to apply your practice, your perspective broadens, and then you see what actually is needed. So in my case, I'm really glad that I've waited this long to go back to get my doctorate, because now I have a very clear focus of what I'm trying to achieve. So whereas when you first start the program, it can be a little more overwhelming, because you're learning this new medicine, it's a new language, and the context of all of that does not start to become clear until you've got a little bit under your belt, right? It's like you're learning the herbs, you're learning the patterns, you're learning the points, but then it's not till after 2 or 3 years that you start to actually synthesize all that together. And so from a broader perspective, everything that I learned, undergraduate education and all of Five Branches education, was applicable throughout my career. But as my perspective broadened, I saw areas where I could use a little bit more knowledge and guidance in those areas. So looking forward to working with Brant Stickley specifically in his trauma-centered approach to acupuncture.
Great. That is excellent. And we had actually a question from the crowd, which is, how did you get hired at Sutter? You applied?
Heck if I know, man.
You applied.
It was, I applied. It was a strange course of events that happened. So I had a community acupuncture clinic in Cotati. It was very successful. Things were going great.
I remember that. Yeah, we were pretty close in our private practices.
Right. Yeah, we were just down the street from each other. And then the big Santa Rosa fire happened. The Tubbs fire.
That's right.
And it really turned everything kind of on its head in Sonoma County. And we found ourselves having a hard time finding a new place to live.
Yeah.
The housing market was just really challenging. And so I was actually lamenting to one of my classmates, John Golden, who lives up here in Sacramento. And
Wonderful.
He said, hey, I heard actually Sutter's been looking for somebody. And I thought, oh man, I mean, why would they want to hire me? I'm just a lowly community acupuncture practitioner. And but I got my CV together and bought a suit and landed an interview, and apparently impressed them enough to ask me back for the second interview, which was really pretty wild. The first interview was just 2 people. The second interview was the entire integrative medicine department. So there was about 12 people there all sitting at a big table looking at me and asking questions. So had to be cool under fire. And so yeah, it's been really awesome, actually. I mean, if I could just have a minute to talk a little bit more.
Please.
About this.
We're all very eager to hear about Sutter.
Absolutely.
So
I work for the Sutter Health Institute for Health and Healing. So we are the integrative medicine department for Sutter Health. We're a very small department, but we're kind of mighty. I mean, like the CEO really, she loves us. And so we get a lot of opportunities financially and everything to kind of expand. We have departments in Santa Rosa, San Francisco, and then here in Sacramento. I'm currently in Roseville speaking right now, where we expanded. I actually opened the Roseville branch with my acupuncture practice here. So we are a multidisciplinary team. So we've got several medical doctors. We have a physician's assistant, numerous MAs, dietitian, and it started off with just one acupuncturist, and they hired me on, and now we've got a total of 4 acupuncturists just here in the Sacramento Valley. And there's so much to say about it, so I'll try and keep it brief. I'll just say this, that what we're doing here is, I think, something very special and very unique in the Western medicine system. When I interviewed, I asked them, what do you want from your acupuncturist? And they said, we want somebody to come in and practice as authentically as possible. And I thought, wow, okay, that's a great offer right there, because what I've heard from other people that are working in Western medicine is that it's very constrained and you're very limited as to what you can do. I've got a friend that works at Kaiser, and I hear the complaints all the time about, how fast-paced it is, how limited it is, and how strained it is. And here we've actually had the opportunity to kind of create our own approach to acupuncture, our own program. They ask you, okay, what's your equipment you want? How do you want to set up your practice? How often do you want to treat your patients throughout the day? And with the exception of being able to burn moxa in the clinic. They don't let me play with fire.
They do not like that, right? I understand.
But otherwise, I mean, I've got the little electronic moxa tool and suction cups, with the pump. So I'm able to do everything else authentically. And so COVID's been interesting because we were treating a patient every half hour. A patient would come through the door. And we have an hour to work with them. But with COVID, to spread things out a little bit, we've got 60 minutes. One-on-one. And so I've really been able to deepen the practice. And so COVID's actually been a little bit of a godsend.
Hey, there's got to be a silver lining, right?
Oh, definitely. So anyways, just to wrap it up, and also just this year, I got permission from the legal department to be able to do custom blended herbal formulas. I was able to do tablets and that sort of thing, but to really leverage the power of Chinese medicine, I wanted to be able to offer custom formulas. And so lots happening here. It's very exciting, expanding quickly, and just I'm happy to be here.
We love that. Love to hear it, because, with COVID, some things have constricted and some practices have constricted and are not seeing very many patients. And now we have, from what you're saying, many different expansions in the works. Frank, Dr. He, can you tell us a little bit about the expansions that you've done? I know you've been very busy during this pandemic, and I was so happy to hear both of you tell me that, because there are some things that have slowed down, and we want to hear about the busy aspect.
Okay, so, after teaching so many students for so many years, I don't want to create a competition or compete with my former students. So I always do something they don't do. Like, I taught trauma. When patient has like a toenail infection, they don't treat. And then I tell them, I treat toenail infection. And patient has like a ganglion cyst. I taught in the classroom, they say, oh, Frank, I'm not comfortable. So, okay, this patient go see Frank. So I appreciate the referral. So I try to, expand my practice, a little bit, widely, and treat some condition other, colleagues don't, want to treat yet. So I think during the pandemic, it's the same thing. People are so afraid of the virus, and then, everybody's so scared of the, the COVID. And then I start telling people, yeah, if I got a chance to treat those patients, and that'll be my, honor. Yeah, it's just, it's to show this medicine works. I think just, what do you expect in your life? It's just, comes, in your way. So I got a chance to see, I think 10 patients last year with COVID, acute, and then none of them died. None of them went to hospital. So I was really excited and also kind of proud. So this medicine can offer hope to people, who are hopeless. Yeah. And also we are trying to reduce the traffic, to our clinic. So I bought a big van, crew van. So this van is big enough to put like 2 tables, but we just only use 1 table. So we drive this van to patient's house, or patient, after hours, they can drive to our house, because it's always on the curb and then always available. So
I love that. That's the van. Yeah. Okay, I'm understanding it now. So it's basically a mobile acupuncture clinic.
We offer mobile care.
Mobile care. Love it.
You see, Monday afternoon, I drove to Madeira. That's an hour and a half drive to see a patient with a sciatic pain. And yesterday afternoon, we drove to Menlo Park to treat a patient who has severe arthritis in knee. So patient is not quite mobile. They need this kind of service, and then we provide. So that's all. I believe there are so many things, I think we had to be a little bit more flexible, creative when we offer acupuncture. So we had to be, we had to make sure this wonderful service or relief for people who need it, and then, accessible, available.
Really interesting. That is so fascinating, because we did get some questions about how has COVID changed your practice? And this is a fine time to jump into that. I actually changed over to work for Five Branches University during COVID. And it sounds like some other major events, the Tubbs fire, I believe that was 2017, if not 2018, changed Marc's practice. And now we have a mobile van that's going and bringing acupuncture to different people because they might not be mobile themselves during the pandemic. Other things that you all are thinking of, Marc and Dr. He, that have, COVID has changed the way that we practice a little bit?
I wear a mask every day, all day. And, I wear the N95 mask. It's not required, but because I'm in very close contact with my patients. In fact, when the pandemic was first beginning, I had a patient who I was working with who came for treatment, and she was complaining of having vertigo. She was on a cruise line and just had returned from Mexico, in fact, and she was having vertigo. And so, of course, I put her through the maneuver, to correct the vertigo. And the
Epley maneuver,
the Epley maneuver, correctly. And, so you're holding the patient's head, and I'm like about 10 inches from her mouth. This was before we were wearing masks. Any case, send her off. 2 days later, we get a phone call from her, and she says, I tested positive for COVID-19. She was on that ill-fated cruise liner from Mexico where everybody got sick. So I had kind of a scare early on. We've had a couple of near misses here, but, knock on wood, I've maintained my health the whole time. Very cautious. We have air filters in the rooms that we run the whole time. And our initial evaluation used to be a 90-minute visit where, it's like 60 minutes of just talk and take the pulse, look at the tongue, physical exam, and then do acupuncture. Well, we moved the evaluation over to video visit. And so we just do the inquiry part over Zoom, or, we have a program called WebEx that we use. And then when they come in for their first visit, take the pulses, do the physical exam and acupuncture. So it cut down that exposure time considerably. Heavy duty sanitation, we're scouring the rooms that's part of why we spread out the visits, because we had to have time to turn over the rooms, scour them from top to bottom, and then let the sanitizing agent dry before the next patient came in. But COVID's been interesting because with all of its challenges, it's forced a slowing down of things, which for Chinese medicine, I think that it lends well to the practice of Chinese medicine to move a little bit more slower and more thoughtfully, instead of everything is always speeding up, speeding up, speeding up. So.
That's very interesting. Yeah. What I wanted to also just mention is that I'm very happy to be vaccinated. When I was in direct contact with patients, I wished for that, and now that is available. And so I wanted to say that along with many of the different aspects of acupuncture, has been incredible for many of us, whether we're practitioners or staff. So I did want to mention that that's been wonderful. And I see in the chat we had a question about herbs. You do start with your herbs from the very first day that you begin. So you're in Herbs 1 at the very beginning of school, and you're in the very first theater class, which is actually an observational clinic class. And I remember in one of the very first classes that I took, they were talking about the jade screen, which is a type of herbal formula that we use very often for immune system boosting. And that's what I've been doing during the pandemic, getting vaccinated and using jade screen. I like that combination. I think it's fantastic. And I would really certainly love to hear also from, Frank and Marc about things that, how we basically combine. We got a lot of questions about Western medicine and Eastern medicine. Are there combinations? Are there benefits? Can you bring them together? And as the daughter of a doctor and a nurse, I'd like to say you absolutely can. And I think that it was very helpful that you went to get your psychology background, Marc. And I think, Frank, when you were thinking about, Western and Eastern, there's a way to kind of bring it into a more integrative place. And the three of us, we seem to like it. So what can you say about that, Professor He?
There's so much we can do in terms of the integration between Chinese medicine and Western medicine.
Yeah.
So I think we have to be open-minded instead of narrow-minded, because doctors, sometimes in the beginning they have like a doubt in our medicine or in our professional standard. But you have to just prove, with some patients, they're doing better, they're benefiting from what we, provided. And then over the time, most of the doctors are very open-minded. They want to learn why we're doing this and how we can help those patients. Because, no medicine is panacea. So when they are, in doubt with the medicine, with the pills, they want to send patient out to you. So I think we should speak their language. We have to be bilingual. We know Chinese medicine, but we also can converse with Western doctors, using medical terms, physiology, pathology. So that's very important. I think in my practice, I have, so much focus on sports medicine. So I had a chance to know a lot of, medical doctors or orthopedic surgeons. I consider myself, my practice like one-stop shop, because most of the athletes, they got injured, they came to my office, and I will decide if this patient needs imaging tests. And if they do, I will order X-ray, to rule out fracture, or to confirm their patient has a fracture, or there may be ACL tear, with the MRI. So after finding out the patient has an orthopedic condition that needs surgery, and then I will call the surgeons, okay, I'm gonna send this patient to you, and you have all the imaging tests already done. So don't delay. So they are happy, because, most of the patients, they have to go to their family doctor, and then the doctor will order X-ray or MRIs, or they send the patient to a surgeon. They often have to wait for a few days, if not weeks. So that's very painful for the patient, time consuming. So my patients are very happy I can make this transition much easier for them. So the patients are happy to see me to work together with the orthopedic doctors. Of course, on the other side, doctors know what I'm doing, and then we are teamwork. We're building teamwork. We are not competitors. So they are sending their patient to me as well when they're not seeing the ideal result after surgery, or they may now be more conservative. Okay, let's try acupuncture first, and then if it doesn't work, and then we can try acupuncture. So
absolutely.
I have a lot of referrals from Sutter House, a few physiatrists and orthopedic surgeons. They send the patient to me. Okay, try acupuncture first, and then maybe chiropractor or maybe physical therapy, and then next step will be a shot, like a epidural, and then maybe surgery later.
Very good. Very good. Really interesting. And one of my favorite things that we did, we'll talk a little bit about what 5 branches externships gave us, each of us. And one of the favorite things that I loved doing was we toured Stanford's teaching hospital when I was in school. And they basically told us that they refer about 25% of their difficult cases to 5 branches because they don't know always what to do. And it's helpful to have, like Frank was saying, that language, the bilingualism of the medicine. And Marc, other things to add about that? I wasn't sure if maybe you wanted to add something about that or specifically about how, we integrate.
I would just stand in complete agreement with Dr. He that it's absolutely possible to bring the two sides together. And I think more of that needs to happen. Western medicine is very powerful, and its imaging and lab chemistry they give incredible insight to processes taking place inside of the body. Chinese medicine has amazing predictive capability, right? I mean, we can tell the direction that somebody's health trajectory is aimed, and we can make little corrections before disease manifests. Western medicine is very strong with correcting disease once it occurs. Doctors are often kind of like, well, there's nothing showing. We ran all the lab tests. Your thyroid's good. You don't have any, autoimmune markers. We'll send you to the acupuncturist and see what the acupuncturist can do. Let them have a stab at it, right? And so that's how I actually started getting a lot of my referrals, from the doctors, is that I explained to them, like, the subclinical conditions, send them to me. I'll take a look at it. And so I've been here a little over 3 years now, and I've built some excellent rapport with many of our physicians here. And I've had cases where, for example, I prescribed a formula for a patient, a very gentle formula, for a patient who has kidney disease, and her nephrologist had made some kind of disparaging comments that, I didn't know that the herbs were actually harming her kidneys because of aristocolic acid. And so I replied back to him very diplomatically and educated him, like, oh, I think you're confusing the, Asarum wild ginger species with the Zinzibur species, which there's none of that. And I broke down the whole formula for him, and I didn't hear back from him. And I was a little afraid, like, oh gosh, maybe I offended, the doctor here. But actually a month later, I got this wonderful reply back from him. And he said, it's so refreshing to meet an alternative medicine practitioner who is so detailed and has a great understanding of both Western physiology and their alternative medicine practice. And so I've learned to be very diplomatic in how I approach the doctors, because I can't order MRIs, for example, direct, but I've gotten very good at reaching out to primary care doctors and phrasing my request in a certain way that gets their curiosity piqued, and they're like, yeah, let's order the MRI. So and also I think it's good. So one of the things we do here is functional medicine, which for those folks who are not really familiar with that, that involves a lot of looking at blood chemistry and lab tests and those sorts of things, and then making adjustments, targeted adjustments with supplements usually, and lifestyle change and things of that nature. A lot of overlap with Chinese medicine. I think learning the functional medicine is also very useful for us acupuncturists, just because of climate change and the uncertain future of our botanical medicine. Right? I mean, I really hope and pray earnestly that we'll still have access to our herbs. But I think it's good now to start preparing and incorporating that knowledge in so that we have something to fall back on. For example, with COVID, I just read an interesting article that bromelain and curcumin together during COVID can actually attenuate the severe inflammatory responses that lead to the cytokine storm and can lead to death. And this is sort of preliminary research, but that's very interesting. I mean, these are supplements that are readily available and would dovetail well with our Chinese herbs as well. And I actually have a feeling a lot of our formulas that were created in Wuhan, for example, in response to COVID, they have like blood invigorating, stasis removing, damp draining properties just the same. So in any case, I think it's really, it's good, to be able to play both fields.
Absolutely. Yeah, that's so interesting what you mentioned about that article. And just to make sure that I'm not missing any questions, I did see that there was one very specific one that we probably won't go over in detail, but it had to do with cervical stenosis. And then, the other question, and I'll direct this to Dr. He, is have you worked much with artistic performers as well as athletes? So that could be dancers, musicians, and so on. And tell us a little bit about how the acupuncture points can treat the inflammation in the joints.
Okay, so inflammation in Western term, can be translated into what we call blood stagnation. So inflammation, that means when the patient has injury, a small blood vessel capillary, torn, and then the blood leaks into the tissue, that triggers inflammation, and what we call blood stagnation. Oh, you can see bruise. Sometimes we cannot see it because under skin. So acupuncture, we often combine with heat or tuina or acupressure, massage therapy. We can really improve the blood flow. So bring new blood, with more oxygen, more nutrients, so the tissue will repair much faster. And I think typically in Western medical practice, patients are instructed to use ice. Ice for acute injury, you can reduce the inflammation or bleeding, but in long term, it's going to affect the healing of the tissue because you block the blood flow to the tissue that needs oxygen and also nutrients. So first 24 hours, you can apply ice, maybe just once or twice for 5 to 10 minutes. And I often, share my information, my knowledge with patients as well as the physician when I give a talk at some Western medical doctors conference. And then I won't say I argue with them. I discuss with them. Okay, we study physiology, pathology, same books, same subjects. So we all know how long it takes for blood, for bleeding to stop. So using ice for a prolonged time, it will not help the patient heal. So that's why in America, we see so many patients with chronic pain, and we have patients with the new terms we call CRPS, used to be called RSD. You don't see that in Asian country. So I never seen any case in China. So after I came here, saw so many patients and using ice, and then I think that's a really huge side effect in the modern practice, medical practice. So just by telling patient to use heat in a proper time, I think the patient healing already speed up. Of course, acupuncture and then manual therapy and the heat can really accelerate even more. So
that's really,
I think there's so much more we need to share with the patient and as well as their physicians. Yeah. So here I want a friendly reminder for Marc and every acupuncturist. So it's not that we are not allowed or we are not qualified to prescribe MRI. You can, as an acupuncturist, you can order MRI, you can order X-ray, pretty much most of the tests, the lab work. So as long as you know the patient needs this condition, this imaging test is medically necessary, you can always order. Yeah.
And quick question, I wanted to break in because I was really interested in this idea of how the doctorate can enhance your practice. So Mark and myself, we went to school, and actually Frank as well, I believe, we all went to school before the doctorate was really as widely available to us. And so the question that I have is, what doors have you, Dr. He, seen open from the doctorate, and what have you noticed?
You mean how the doors open to me?
Yeah, so we have people that are curious about what is the difference between having a doctorate versus having a master's. And in general, there are some doors. Of course, you can do a lot with a master's, but what doors kind of open in career opportunity having a doctorate as well?
Oh, okay. In my opinion, it's not that much different. We say in California, you should need to show over 3,000 hours and you qualify to sit for the board exam, right? And after you become licensed, and then promote yourself and then tell people you are wonderful, you are effective. So that's enough. And then as long as you have patience, and then I really don't care how patients address me. Like, most of them, they still call me Frank, although I'm pretty old. So it really doesn't matter. And now, when doctors refer their patient to me, and then their patients are more respectful, and then say, "Oh, Dr. He, my doctor, Dr. Wang, Dr. Jan, Davidson, they, refer me to you," and then they have, they're bowing, they're showing a lot of respect. To me, it's not big deal, it's how, and also if I can help my patient, if I help patient feel better, they know I'm a healer, I'm a doctor. So. And then I think that as long as you get into this field and then be confident and go out, reach to the community and also even the conventional medical professionals, and tell people you can do wonders for your patient and also their patient. Yeah,
absolutely. And Mark, you've had the experience of being both in private practice and working in more of a integrative facility setting, working at a community style acupuncture clinic. Can you tell us a little bit about the differences that you noticed of each of those?
Well, I mean, the practice types are pretty different, although my practice was a little unique because I not only did the group setting community acupuncture, I also did private treatments at the same time. My clinic was kind of a hodgepodge. I built it with $2,000 in my pocket. I'd scrimped enough money to put a deposit for the office space, and I scavenged recliners and a desk wherever I could find them. So I really built it up from nothing. But like Dr. He says, once you start to demonstrate your capabilities to the public, word of mouth travels, and satisfied customers are your best advertising, right? I remember handing out flyers on, East Katati Avenue, and that was terrible. But a few patients, their sciatica disappeared overnight, and then they tell their family, and then their family tells a friend who's got sciatica, and they come, and and then you reach a critical mass, and it just exploded from there. And then I was booked solid for weeks and months out. I'm currently booked out like about 5 months typically at this point, so it's a little bit hard to get in to see me. Just to speak to the DAOM, the whole doctoral thing, so a lot of my patients address me as Dr. Marc or Dr. Velez, and I always just say, please just call me Marc. Thank you. In the martial arts, and in the contemplative practices, somebody's called guru or sifu, and it's not a title that you take on yourself. Right? It's something that your students and the public bestow upon you. Mm-hmm. And so I'm deeply honored, to receive such respectful address.
Yeah.
I feel like, I would like to go ahead and take it all the way so that then I can actually legitimately put myself out there as doctor. Beyond all that, I totally agree 100% with everything that Dr. He says about that. There's not much difference. You don't really absolutely need the doctorate, but from the view of the general public who's not very well educated in Chinese medicine or acupuncture, and also the medical establishment for many of the folks who are less educated on what we do, having the title doctor adds some gravitas to the whole situation, and perhaps maybe taken a little bit more seriously.
Yeah.
It's unfortunate that that's, one reality of it. Since I do not hold a doctorate, I've had to forge my way with forming good rapport with the physicians and earning their respect, the hard way, which I think is better, actually. But now at this point, I've been in practice, over 10 years, and I think, okay, well, there's to stay competitive and to ensure I'm able to sustain my practice in the future. I don't know what the future holds. So I think it's a good idea. And also, just for the sake of deepening my knowledge base in this medicine, Chinese medicine is so vast. A lifetime of study, you would never cover everything. And I've really made an effort to cover all the different aspects. And it's just, I'm still just scraping the surface. And so the doctoral program provides a vehicle for me to explore greater depths of Chinese medicine and to bring a greater medicine to the public and to our world as a whole. This is healing medicine for the whole planet, in my opinion. That's a whole nother discussion that we can get into another time, but we're ideally positioned to really make a difference in this world, mainly because our medicine hinges on the Yangsheng practice, right, of nourishing life. And so we're not only just correcting disease and musculoskeletal pain and these sorts of things, like everybody who comes through the door, like I give them a complete assessment, and then I'm asking them, like, well, tell me about your sleep and what's your diet like? Your diet, oh gosh, I think your diet's contributing to your chronic inflammation. That's why your back's always hurting. So incorporating these approaches into medicine, I think, stands to make an improvement for humanity as a whole. And so, because of that, I think that however deep we can take that practice, I think it's worth engaging. So,
yes, that it's so wonderful to hear you speak about all of that. And, I wanted to just say myself that my father told me when I was a small girl, you can be any kind of doctor you want to be. So I became a doctor for that reason. I think we all have our different reasons, and they're all valid. And the information also that you will find as you go along in your career trajectory is that certain doors will open to you for different reasons. And it really doesn't hurt to have a few little aspects in your arsenal. It makes you a better practitioner, and it also helps you to find your way in the world. And so I would say that we're going to speak for just a second here about the QME program, because both you, Marc and Frank, both of you are QMEs, and you are qualified medical evaluators, and we don't want to spend too much time on that because it's separate from 5 branches, but I do find it so interesting that both of you decided to go that route. And for myself, I did a doctorate in something different. It was a little bit more in kind of an integrative, almost like a naturopathy kind of thing. So if you would, Marc, if you'll speak just for a moment about how did you apply to be a QME and so on?
Basically, you take a couple of classes to learn how to write the report. That's the big deal, is knowing how to write a medical evaluation. It sounds simple, but it's actually fairly complicated, because there is a specific format, and then there are certain metrics that you have to include. So you take some seminars on the basics of that, and you sit for the exam that's offered by the state of California. And for me, I've done only very little with the QME specifically, but it has opened many doors for me. And I think that I probably wound up being able to land this gig at Sutter because I had that under my belt early on. And then I started working for Concentra Urgent Care, doing work comp cases there. And I was able to get that gig because I said, oh, well, I'm an acupuncturist and I'm a QME, so I know the work comp system. And they were like, great, you know, come on in. So, and then when I came to apply at Sutter, I said, oh yeah, I've already worked in Western medicine environment. They're like, great, we love that, you know. So, and it gives you more juice, it gives you, you know, more legitimacy. And I think actually the report writing actually is really good, because that, if you can write good reports, you can get paid, right? And I don't just mean for a qualified medical evaluation. I'm talking about get paid for insurance, because you're taking measurements, you're showing meaningful progress, and you're able to express that in a way that is well received by the insurance adjusters, and then that's conveyed also to the fellow medical practitioners, and they read your report and they're like, oh man, was this from an orthopedist? Oh my gosh, this is from an acupuncturist. I can't believe it, right? And so there you go. You've got that rapport established with those providers. So, and I'm greatly indebted to Dr. Huff for that, because, you know,
Same here.
He was the one who encouraged me to go for the QME. I took his class. In fact, that was one of the seminars I took that got me started. And so, so thank you, Frank, for that.
Oh, my pleasure. My pleasure. Thank you.
Very good, very good. And to speak just for a moment about some of the other certifications, the different things that you can do, because people were wondering, how does 5 branches connect to, let's say, a TCM hospital in China? We do have externships both in China, although we're not doing them now during COVID, but we have intensives, different places actually all over the world, and many of them right here as well in the Bay Area. So different hospitals you can go and you can work in, different places that you can see somebody's practice. Many alums go on to practice alongside Frank Huh, I happen to know. So that's something, or they inquire about it. So that's always very interesting. Many of our alums either team up with one another or go to be hired at places like Sutter, Kaiser. I know one fellow who loved Kaiser, loved Concentra. You mentioned Concentra. I loved working at Modern Acupuncture, but I am very glad to be in academia once more. So tell us about, if you would, what has changed for you and grown inside you? This was a question I liked from becoming acupuncturist. And Dr. Ho, if we could start with you on that one. What has grown inside you from being an acupuncturist?
Okay, so first I want to add a couple of things for the title. Either QME or DALM, I think they're wonderful titles. You know, if you have time, you have the resources, you should, you know, invest yourself. You know, I think it's totally worth. It opens many doors, like Marc says. I think our profession needs to evolve and then continue to study. That's very important. So I think we need to, you know, just continue our journey. You know, 5 branches offers a lot of, you know, opportunities. It does, you know, either DLM program or our sports medicine or orthopedic program. So just go ahead, take it, and then you will not, you know, regret. I think in the future, you know, my practice is very big right now. You know, it's still growing, and we're happy to take externs, you know, interns for externship, and we also offer residency and fellowship. And anyone trained at our practice, you know, we, you know, mutually agreed, and we believe we can nurture each other. And welcome to join our team. So I think we offer a very good future for anyone who trained with us. I think in the future, you know, you can train in China, you can, you know, follow a professor you like, and then just, you know, follow a role model. I think success is not like just a dream, you know, it's reachable. Yeah.
Wonderful. And same question to you, Marc.
That's a deep question.
Oh yeah, I was going to say it's almost hard to answer, really. Truly.
What has grown within me? Compassion. I think that's, you know, in all honesty, that's what's really grown the most in me. A love for knowledge and a love for nature. You know, the botanical medicine really, I walk through the forest and, you know, it's just in wonder. And every plant that I see, it's like I have communication with. But I think compassion for the human condition is really the greatest thing that's grown inside of me. And because we deal with a lot of very difficult situations, and you know, we see some of the toughest cases. You know, we see the cases that nobody else can do anything with, right? And so to be able to still hold a space for those people that nobody else wants to deal with, so that's helped me to open my heart, you know, more. And so I've taken that as sort of like a big part of my whole life path. You know, it's like the path of the bodhisattva, you know, until everybody is uplifted, we're all still being held down. So it's not enough just to lift myself up. Everybody has to be elevated. And so I owe a lot of that perspective to Lonnie Jarrett, who, you know, we were talking about externships. I did not have the opportunity to go to China to train, but in recent years, I've spent like probably the last 5 years working with Lonnie Jarrett and studying under him, and he's really expanded my perspectives, you know, and given me a lot of those tools to work with the psycho-emotional aspects of patient care. So yeah, the more perspectives you can hold simultaneously, you know, the greater the truth, the more expansive the truth is, right? Because everybody's holding a little chunk of truth, but it's a partial truth. And so we want to pull them all together, get a bigger picture.
Love that. And, you know, it's amazing to me. There is so much to talk about and we are basically out of time. But what I wanted to do is very quickly answer a couple things that were in the chat. We do often learn about TCM, but also somebody was asking about mirroring techniques. Absolutely. The balance method is very often used, and some people call that mirroring. Some people call it you know, different aspects, Richard Tan's style. There's so many different types of acupuncture. There's a style that's taught to acupuncturists at Modern Acupuncture. There's a certain style that you will create yourself, given what you learn and your own personality and your own sort of knowledge. In addition to that, I wanted to say that yes, you can call yourself doctor when you get the DAOM or the DTCM or the, you know, and so on. We have a bridge program, which gives you the final aspect between the master's and the doctorate if you already have your master's in acupuncture. And so just to wrap up, I'd like to say that if you're interested in this medicine and this career, then you need to speak with one of our admissions agents. One of our counselors will speak with you. We have Eleanor Mendelsohn in Santa Cruz. We have Liz Tan in San Jose. And their information is up sort of in the top of the chat here. But very briefly, you could just, you can recall it. It's admissions at 5branches.edu for Eleanor Mendelsohn, and SJ admissions, like San Jose admissions, at 5branches.edu for Liz Tan. And we really encourage you to seek more, seek out more different webinars, maybe take some of our trial classes that you can find on 5branches.edu, and keep in touch with us. We really want to do this again with different alums, and so maybe have some of the same back, because I still have so many questions. So it has been a delight. Dr. Frank He, thank you so much from both of us, your former students, and we so appreciate it. And Marc Velez, it is a pleasure once again to see you again. So thank you so very much. We really appreciate it, and have a great night, everyone. Thank you.
Pleasure was mine. Thank you.
Thank you, Marc. Okay.
Thank you, Frank.
Yeah.